Today's webinar features Dr. LaShara Davis, who will speak on the topic, Explore Health Stories, a guide to sharing your experience using digital storytelling, and as a continuation of Dr. Amy Waterman's April 11th presentation. Before I introduce Dr. Davis, I have a few housekeeping notes. Today's webinar is being recorded and will be posted on our social media platforms. We request that you turn your cameras and microphones off during the presentation. We will not record the Q&A portion. Once the presentation is complete, we ask you to turn on your cameras, and if you have a question or a comment, to ask it, to ask our presenter directly. Or you can use the chat box. You may also add comments and questions in the chat. If I just read ahead, I would know that. Now, it is my pleasure to introduce Dr. Davis. Dr. LaShara Davis is a scientist in the Patient Engagement, Diversity, and Education Division, representing both J.C. Walter Transplant Center at Houston Methodist Hospital and the Center for Outcomes Research at the Houston Methodist Research Institute. She is committed to research on patient-centered care, health message and education development, and reducing racial and ethnic health disparities through communication. Over the last 17 years, she has been engaged in research exploring the many facets of deceased and living donation. She uses a mixed methods approach that employs research tools, including surveys, questionnaires, interviews, and focus group methodologies to gather the patient perspective to inform health education and message design. She has worked at all levels of campaign development, including formative stakeholder interviews and campaign material design. She previously worked as an assistant professor of communication in health and faculty liaison for diversity, equity, and inclusion at DeSales University, where she helped launch the campus-wide diversity initiatives and programs. She has also worked at RJW Barnabas Health, formerly St. Barnabas Medical Center, in the Renal and Pancreas Transplant Department as a senior researcher, where she conducted research on educational strategies to reduce racial and ethnic health disparities in pursuit of transplant and explored methods to improve the design of the Transplant Center standard patient education. After 5 years in an exclusively teaching role, she is excited about returning to research full-time with a renewed focus on engaging in community-based participatory research design, patient engagement, and patient-centered education development. Dr. Davis, I pass it on to you.
There we go. I had a little trouble there trying to get myself off mute. Thank you, Mary, for such a wonderful introduction. Every time someone introduces me, I say, oh, who are they talking to? Or who are they talking about, rather? You know, it's always a surprise when someone shares with you the things that you've been up to when in this type of setting. But I am honored to be here today and excited to share with you a little bit more about the digital storytelling library that we have been creating alongside Dr. Amy Waterman. So I'm excited to take that to the next level and have the opportunity to offer licenses and the experience for all of you, those who are interested, to share their stories as well, So first, I want to talk a little bit about where I'm placed at Houston Methodist within the Transplant Center and the surgery departments. A lot of the research that we do is really considered patient-oriented research. So we're looking at how we can improve knowledge and decision-making and education such that patients make an informed decision about their treatment choices. Now, this is done in various different methods, various different strategies are used to help patients do this. But today I want to focus specifically on digital storytelling. Before I do that, I do want to introduce some of my colleagues. Dr. Amy Waterman, who spoke on April 11th. I don't believe she'll be joining us today, but I did want to acknowledge her. And then my colleague, Catherine Pelican, who will be joining us in a bit here for this talk. But we all landed at Houston Methodist in September after, working in our various areas, me coming from New Jersey, Dr. Waterman coming from UCLA, and we've joined together to help to push this effort forward, being the first patient-facing research line or research service line here at Houston Methodist. So it's exciting. We're charting new territory and setting new standards for patient care and patient engagement in this area. Now, before I get into the practicalities of digital storytelling and the digital library, I did want to share a little bit about digital storytelling as a whole to kind of represent us to the context within which this all exists. So digital storytelling utilizes technology to collect meaningful patient stories that can transcend different barriers that are present in traditional patient education. When we think of traditional patient education, they are pamphlets or brochures, sometimes written at accessible health literacy levels, sometimes not. Sometimes the information is very dense or hard to grasp, hard to understand. And this is even for someone who is experience with health education, right, or health information. Sometimes the information is still pretty dense and hard to grasp and to make sense of. And so through stories, through storytelling, we can amplify the patient voice and provide support that can encourage consideration and uptake of healthy behaviors through a different avenue than the traditional patient education that we receive. Storytelling has been shown to be relevant, relatable, emotionally engaging, and all of these are different strategies that can be used to help expose people to different healthy behaviors, but also get people to share their stories, which in some instances can help others who may be considering similar health choices. Now, when we pit digital storytelling against traditional education, we see that there are just quality differences between the two. When we look at digital storytelling, the content is created by patients. They're informal narratives, stories. We share, we learn through stories. When we look back at information that we gather from our childhood, right? It's through stories that we learn what to do, what not to do. This oral tradition that is found in many cultures helps us to learn the ins and outs, the good, the bad of what's expected of us as individuals in our societies. It presents experiences. It's also health literate, because these are often presented in such a way that are conversational. It's easier for people to access. People who actually look like you and I are the authorities in the digital storytelling world. Now, as opposed to traditional education, where often the information that's there is provider prescribed, they're formal presentations. We often see these things very fact-driven. And sometimes it's health literate, but oftentimes the information there is very dense, as I mentioned before. And in these cases, providers are the authorities. So oftentimes there may not be the same level of connection that someone might find in the space of digital storytelling. Storytelling works because it gets people curious to learn more. It empowers donors and recipients to talk about issues that matter to them, things that they want to focus on. It also encourages peer-to-peer sharing about what's important. Very emotionally powerful, and not just facts that you would find in brochures. It's also a gentle invitation to learn more for early learners who may not be ready to jump head first into learning about a health issue. Storytelling also culturally grounds the messages and experiences of target audiences, because once again, storytellers can look like the viewers. So we spent some time over the last couple of years working on different strategies to recruit and support storytellers to help build a digital storytelling library. The first effort, or the first venture in this effort, was the Living Donation Storytelling Project, which many of you, if you attended Dr. Waterman's talk on April 11th, you've heard about this website. This website is located at explorelivingdonation.org, and it officially launched in April of 2019. From that time, we've collected over 200 stories from diverse storytellers. You can see the actual pictures on this slide here are representative of the storytellers that are in the library who have shared their stories graciously with us. Now, the storytelling platform allows a bit of creativity in that although we provide some open-ended prompts that guide the discussion or guide the stories that people share, storytellers are really allowed to share whatever they like to share within the context of, related to living donation. But the prompts are there to help guide them about topics that we found people often share about, such as their fears about living donation, questions that they had in pursuit of living donation or living donor transplant, what motivated them to either get a living donor transplant or to donate, the risks and benefits that they experienced, the challenges and how they overcame them, and then post-transplant and donation stories. We've also found that these types of stories lead to advice from the perspective of a peer who's gone through the experience, which differs significantly than what one might find from a provider. The provider says, well, I've done hundreds of surgeries, and generally this is what the experience is that that my patients have shared with me. Wherein if someone has actually gone through the process, they can say from their personal experience, this is what the experience was for me, which can be very powerful and helpful as someone is considering engaging in these processes. After completing the stories, the storytellers complete a post survey about the recording process. And this just helps us to understand what the experience was like. It also gives us some information about one's motivation for sharing their story. It also gives us information about how we can make improvements in terms of the process of collecting stories. And so we do collect this information such that we can make improvements as we go along. I wanted to share with you so you get a sense of the types of storytelling prompts that we provide. This is for kidney donors and kidney recipients. The prompts are set up such that one would or could begin a phrase such as, I didn't think much about kidney disease until, and then kind of fill in the blank based on their own personal experiences. Or when I learned about kidney disease and its treatment options, I was surprised that ... For recipients, it's the same type of experience where I started having these symptoms where someone might list out the symptoms they had, and they were diagnosed however many years ago. To stay alive, I have to go for dialysis, which is, and then they might describe what they go through, providing a realistic experience, or I guess you could say expectation for what these processes look like to guide and in some instances provide confirmation or reassurance to others who may be going through similar things. That's different from traditional education. Stories are filmed privately. When you access the Explore Living Donation and you select to tell your story, we ask for your name and your email. These stories can be recorded on your phone, tablet, or desktop, whatever device works for you. You'll see later in the slides here, I have some example stories. You can see some people are recording at their desks. Some people are recording in their living room on a couch. Some people are recording even in their cars. So really the space and the place that's most comfortable for the storyteller, that's where many people record. Here's an example of what the setup looks like as you're going into recording your story. You'll find out from the beginning how many questions there are, but also you'll get the opportunity to view all the questions from the start to determine which storytelling prompts you'd like to use or you'd like to share, noting that storytellers don't have to respond to all 17. We found that when you provide a large number of prompts, people often respond to all of the prompts, but you can choose which storytelling prompts you might want to share. I'll give an example of this later on, but this is the screen that appears for each prompt. So you would see whichever question referring to the prompt, the individual recording would say, "Hi, my name is LaShara Davis," or LaShara, and I donated a kidney to my sister about 6 months ago. You would record this section. You can review it to make sure that it meets your standards and re-record if it doesn't. The beauty of this program is that after you have responded to the prompts, it stitches together each of the individual responses to the prompts to a final video that you can review and record and re-record until it meets your standards. Here are some other examples of prompts that we've used. That's that first prompt. I ultimately decided to donate a kidney because, once again, the storytellers can choose which prompts they'd like to respond to and leave the others to the side. After responding to the prompts, as I mentioned, the software stitches together an individual video inclusive of whichever prompts the storyteller responded to. And as you can see on the right side here are some examples of some of the final stories. We have stories representing kidney donors and recipients, family members, friends, donors and recipients of different types. We have some stories from participants from the kidney paired donor programs, as well as the directed donor programs. One of the wonderful things about this library is it's searchable. You can search for donor stories, you can search for recipient stories. You can search based on gender, you can search based on location, race, ethnicity, story type. So if you're looking for a recipient or a donor or a family story, you can search based on specific topics, even based on your preferences or maybe information that you're interested in knowing more about. All of this is available in this searchable library. Here's some specific examples from the I Need a Kidney perspective as well. Here's the full list of the different search criteria that can be used to narrow down the library that you'd like to see, the story, or rather the stories that you'd like to see. I now want to give an example or provide or share this video that goes through briefly what the storytelling sharing process looks like. So as you can see, the process is pretty simple in terms of getting access to the website, signing up for a license to share your story, and then creating and sharing your own story. Here's a compilation video that we've created with some sample stories that are now part of the library that I wanted to share with you as well.
My name is Katie Walker.
Hello, my name is Richard Hicks. My name is Matt Ronan.
My name is Susie. Emily.
My name is Diane.
And I donated a kidney to my cousin. And I donated my kidney to my brother Carl.
I donated a kidney to a stranger.
I had the honor of donating my kidney to my daughter Monica. She was 3 years old at the time.
I was motivated to donate a kidney to my brother because of, one, what he was going through, and two, that my brother needed a hero.
It was really powerful. It was a powerful moment to see somebody go from so sick to looking so much better in such a short period of time.
It was, words just can't describe it. She just and her color was back, and she looked so good.
The best moment after my surgery was on a Saturday. My brother came downstairs. I was eating breakfast and kind of doing my thing, and he said, "Bro, guess what?" And I said, "What?" And he said, "I don't have to go to dialysis."
I would just encourage you to remember that a very short interruption in your life, a matter of days or weeks, can make the difference in the rest of someone else's life.
And so this is what the stories can look like. That particular compilation video was just taking snippets from different prompts from different storytellers' videos, and we had them merged together to create that compilation video. I did want to share with you, though, an example of what an individual story looks like. And so I pulled together a few of the Canadian storytelling stories to share with you today. So our first storyteller is Ken. He's a kidney recipient.
I'm Ken. I received a living kidney donation from my wife 11 months ago. I was diagnosed with a kidney disease when I was 35 years old. At that time, my nephrologist told me that I would be treated with medication. I wouldn't see any changes in my day-to-day living. But however, at one point, I would probably end up be on dialysis and eventually need a kidney donation. Living without a working kidney had an effect on 3 areas of my life. First of all, in work, I travel a lot for my work, and I couldn't do that any longer. So I was assigned tasks that were not as challenging and were not as interesting to me. Secondly, it affected my family life. I was no longer available for all of the family affairs or gatherings or celebrations. And thirdly, I'm a very active person, and without a working kidney, I was no longer able to run or swim or participate in sports to the level that I was used to and liked. The first time I had dialysis, it was a little bit of a relief because I wasn't feeling well for a year and a half before the treatment started. But at the same time, I felt very anxious because I knew that my day-to-day schedule was going to be profoundly impacted by these treatments, and the schedule and a lot of control was out of my hand. My family's life changed in a few ways when I was on dialysis. I wasn't available for dinner every evening, and of course I had to miss some family gatherings because of the dialysis. However, we learned to adapt. We got used to the new reality quite quickly. When my doctor told me a living kidney transplant was my best option, I was concerned. I didn't have relatives that were very close, and no living relative in my immediate family. So I knew it would have to rely on my wife or a friend. So this was created a bit of anxiety for me, to say the least. I found it really easy to talk to my friends and family about living donation because I had kidney disease for 12 or 13 years before I was on dialysis. So many of them knew about it, and they were extremely supportive of me and my wife and my daughter. So it was an easy conversation to have with my friends. I was scared that I wouldn't find a match because I didn't have a family that was alive or close to me. I was also a little scared that I would have to be a burden on someone else and ask them for such a huge favor that would potentially change their life as well as mine. My wife and I had talked about her becoming a kidney donor for a very long time. But when the reality set in that she would have to go through all these tests and take so much of her time, I realized what a burden I was going to be on her. So once I was at the same time I was being very grateful, I was also feeling quite guilty of what I was putting her through. I had many questions about how this would affect my wife, Carolyn, including, how would this impact her physical activity or mental health, and also how would it affect her work? Her work is very important to her, and I knew she would have to miss quite a bit of time to be a donor. I was really hoping that this would happen, but at the same time I was anxious that it wouldn't work out. My wife and I talked about it a lot, and she was very reassuring, and she shared in my hope that we could go through this together and return to a normal life that we had before I was ill. We learned about the whole process together, and we actually found it quite fascinating. We found it very interesting how they removed the kidney from my wife, and also how and where it would be attached in me, and also about the long procedure starting in the morning for my wife and ending in the evening for me. I didn't have the opportunity to talk to my wife before the operation because I was in the night before. However, I did see her get wheeled by just after her operation was completed and I was about to go in. When I saw her, I was actually petrified. I thought, what have I done? What have I done to my lovely, healthy wife? My wife went in first, and her procedure took about 4 hours, and then mine in total probably took 5 or 6 hours. And we were in the hospital together for 6 days. When I got out of the hospital on the 7th day, I felt like a completely new person. I was now able to go swimming. I could go for walks in the evening. I had dinner every night with my wife and family. It was like turning back the clock to a younger, healthier me. Life without dialysis was a huge relief. I found the whole process of going downtown and waiting in line to get hooked up stressful and frustrating. Although I had some good times with some people there, without the dialysis in my weekly schedule, I was able to have more freedom, less stressful, less anxious life. It's been 11 months since I received a kidney from my wife, and we feel great. We've always been close, but we've become much closer through this whole process, and we certainly have a greater appreciation for our time together now that we have more of it. The relationship that I have with my wife and donor is wonderful. We feel much stronger having gone through all the stress and uncertainty in this process, and we certainly feel that we can make it through anything now. And quite frankly, we don't worry about little things as much as we used to, so it's been a wonderful experience. My favorite memory of this entire process and journey, whatever you call it, is afterwards when my wife and I were sharing a semi-private room, and all my wife's friends and the doctors and nurses and the donor staff treating my wife like the hero she is. It was wonderful to see. I really want to thank Carolyn, my donor, because without her generosity, I would not have the health that I enjoy today. I would not have the activity I have today. I would not have the time I have today, and I certainly would not be as stress-free as I am today. My advice to others who need a kidney is to talk to people about what you're going through and to make sure that they understand the impact that this has on your life. And also I would remind people or ask people to don't give up hope. Stay positive, stay active, and again, talk to people that are close to you about what you're going through.
I also want to share the perspective of a donor.
Hi, my name is Francis, and I donated my kidney to a young man about 1 year ago. I didn't think much about kidney disease until I met someone whose brother was on dialysis. When I learned what kidney failure would mean for my friend's brother, I wanted to get involved and see what I could do to help him. When I learned about kidney failure and its treatment options, I was surprised seeing what dialysis was and how difficult life was being on dialysis. I ultimately decided to donate my kidney because I knew someone needed one and it would drastically change their life. My family was a little worried and they thought I might change my mind halfway through, but I was committed with my decision. To me, the benefits definitely outweighed the risks. The waiting period got harder for me because I was worried I wouldn't be eligible in case anything health-wise came up. It took about 3.5 years between the day I decided I wanted to do it and my actual surgery. The part that helped me was just being patient with it and knowing that if and when it's going to happen, it will. As I was being rolled into the operating room, I wasn't going to get too excited until the surgery actually happened, just in case anything postponed it. The best moment after my surgery was waking up and it being over with. And the other best part was being able to have ice chips because I was very thirsty before surgery and I wasn't allowed to drink. So once I had my ice chips, I was very relaxed and happy about it. My recovery wasn't too bad. I was in the hospital for about 10 days after surgery. I had open surgery, so I had an epidural for pain management, and because of that I had to have my catheter in for an extra few days, which is probably the worst part of surgery, was being in the hospital with that. My recovery, it was about 3 months before I was exercising and doing things pretty normally, and I went to work after about 2 weeks after surgery. What I learned about myself and others is patience. It's not an overnight process to donate your kidney, especially being in the exchange program. It took about 3.5 years, so I've learned a lot of patience over that time. After donating my kidney, my life has returned pretty normal. Some days I don't even notice. So it's been a year now and I've recovered quite nicely. Something I didn't expect was waiting 3.5 years to donate. I originally thought I could do it in 1 month, but there's quite a few tests and appointments you have to book, and then being in the exchange program, there's a lot of factors in that. The only thing I regret was having an epidural for my open surgery. I think that might have been okay, but I wish I would have planned to talk to someone about getting my catheter out a lot sooner, because it was very uncomfortable and a lot of bloating, so I would have tried to remove my epidural within 1 or 2 days after surgery. Looking back, the best part about donating my kidney was giving my original recipient hope and something to work for. Unfortunately, he passed away, so I was able to give my kidney to the next man on the list. And I was told that it completely changed his life. The best advice I could give someone who is thinking of being a living donor is go get the testing done. Contact your local transplant office and at least do the test to see if you're eligible, and then any questions or information, you can get it all with them, just to be informed about it. You don't have to donate, but at least you can have some information and kind of see what the process is.
So as you can see, these stories are just a compilation of the different prompts that we provide for patients, many patients and participants. Many respond directly to the prompts that are provided. Some venture off and do their own level of storytelling, if you want to refer to it as that, or their own level of sharing their story. One example is this gentleman here. I'm going to skip to about 3:16.
Wonderful life that I have that I'm so grateful for. I also wanted to be able to help somebody else, possibly even save their life. I wanted to make a difference in life. I wanted something more fulfilling out of life. And absolutely donating my kidney was as fulfilling as anything I've ever experienced in life, including marriage and children and other things that are that important. Was the donation itself hard, painful? Well, thinking about it, in my whole life, there are many more things that have been more difficult to deal with, both mentally and physically, than donating a kidney. If I could donate my kidney, if I could donate again, it's something that I would do in a heartbeat. So my living kidney donation, how did it come about? Well, it's really ironic. I'm a regular blood donor, and 10 years ago I was waiting to donate blood, and I looked down, and in front of me was a pamphlet much like this one that said, "Be a living kidney donor, save a life." Well, it started me thinking. I believe very much in fate and that things are meant to happen. So I started looking on the internet. I went to the library. I contacted the coordinator whose number was in the pamphlet, and I met with them and I got more information. And finally, I discussed it with my spouse, with my family, and I decided it was something I want to do. And I had their support to do it. Having that support is absolutely critical. If you have people that are close to you, you need their support before you proceed. Otherwise, you could run into problems in the future that will prevent you from being able to donate or cause some serious problems with those relatives. So, my own experience. I started a whole slew of tests, and there are a lot of tests, and over about a 9-month period, there were lots of them. Soon into the process, not only several weeks into the process, I got a call from the coordinator saying, listen, we've found something with your kidney and we need to get you to a specialist to look at that before your process continues. Well, the problem was they found a small kidney stone. And after more tests and discussing it with the doctor and finding out that I never had any history of kidney stones, it was one single small stone. There was no history in my family. It was deemed that that kidney stone would not prevent me from donating. And I continued with more tests. A short time later, I got another call from the coordinator. This time, I was more surprised because they said I had something come up on my heart tests and I needed to see a specialist and the process was going to stop again. Well, I was really amazed with that because I've really been a very physically fit person in my life and always prided myself on that and was kind of like shook up by that. But anyway, I saw a heart specialist and found out that I had something called left ventricular hypertrophy, which sounds pretty crazy, pretty serious, but in fact, all it was I had an enlarged heart that related to the fact that I had been very active in my life, largely with cardio-intensive activities, and I had an enlarged heart. That this would not prevent me from donating. My heart was super strong to be able to donate. There would be no problem there. So I continued, and after many more tests and many months later, 7 or 8, 9 months later, I was contacted to say they found a match for me and that this person from the paired exchange program lived in Vancouver and that I would have to fly to Vancouver to donate my kidney. I was fine with that. So on April the 28th, 2010, I flew to St. Paul's Hospital, and at 6:30 in the morning the next day, I went into the operating room, and 4 hours later, I woke up, and the first person that I saw was my surgeon who removed the kidney to carry out the process, Dr. William Gourlay. I was probably close to the 1,000th kidney operation that he had performed, and to me, he was a bigger hero than I could ever be or I could ever imagine. He had a big glass of water for me that I just gulped down because I was really thirsty. I then went to my hospital room and spent the next 3 or 4 days convalescing. The first few days were difficult because as with any surgery, as I learned in my life previously, when I have an anesthetic, I have a bad reaction to that in that it causes me nausea. For the first few days, I couldn't keep anything down except for liquids, and even that was difficult. And I really look forward to my first meal on that third day. Unfortunately, hospital food hasn't improved a lot over the years. And to compound matters, a large part of that meal was a big pile of peas, and I've never been able to eat peas or stomach peas. So I didn't eat them, but I got through it. I was discharged from the hospital a few days later, after 4 days. And my operation from the paired exchange actually caused 3 other transplants to happen at the same time, which I learned, and that was really gratifying. And I also learned that the patient, the person that received my kidney, was doing quite well. So I was really happy with that.
So here's another example of how the stories work. This particular donor answered or responded to one prompt and just let the story flow. So as you can see, some storytellers use the prompts and respond individually to the prompts. Other storytellers let their story flow more in a narrative form. Once again, the beauty of the software and the beauty of this project is that you can share your story in any way that you feel comfortable sharing. In the essence of time, I want to skip to this video here that talks about some tips for success in terms of sharing the story. Now, as you can imagine, I've shared a little bit about how this process works, but you'll have a cell phone or device of some sort as you're sharing. I have my cell phone here as you're sharing your story, and you're talking to yourself. It may at first feel uncomfortable. It may at first feel pretty weird. You can see yourself as you record, which often is a little strange and a little awkward. And so Dr. Waterman recorded this video here to share some tips for success to help people as they navigate the process of sharing their stories.
So I find doing this even now, talking to you, to be a little bit nerve-wracking. And I don't know why, because it's like we're all kind of just talking to a screen. But one of the things that makes me laugh is that you never talk to yourself on a screen, right? So you can actually see yourself talking. So one of the things is just to kind of let that be and don't talk to yourself. Talk to a friend going through this or someone that's going to watch this that you may never know. That's the first thing. So the second thing is think about the light around you. I want you to take a look at where I chose to put the camera. So what you can see is that you can hear me. It's as quiet as I can find a place. And then there's some color and some light. We found that some people, if they have a lot of light that's really bright right behind their head or above their head, they can look like they're in the witness protection program. So we don't want you to do that. We also want to see your smiling face. The other part is people are like, I want to look perfect. And I want to say that this isn't what this project is about. This is about real people doing amazing things and facing challenges and communicating. So do not worry about what, your hair looks like, or if you have, the perfect makeup, although I did put on lipstick, so I understand. But the other thing I want to say is, let's say you did something and you go, I don't like this at all. This technology lets you stop and review and then redo the video if you so want to do it as many times as you want before you move on to the next prompt. So know that there'll be prompts above you, and you can choose the prompts you want to do. So if there's a prompt that we're offering you that you go, that's not my story, just don't worry about it. Just skip that one. And then you will have a short set of prompts that will show up at the top. And these are the ones you've chosen. You answer these. And if you do the first one and it feels a little awkward, totally fine. Stop it, redo it. The most important thing is to approve it before you move on to your next prompt. At the end, all of these will seam together, and it'll look like you made this wonderful share from beginning to end of all the important things that you wanted to share. So I've had the privilege of talking to and listening to over 100 people who've made these videos, and they've told us a lot of tips. So I want to share them with you. So the first thing is you have to decide, do you want to do this on your computer or on your phone? Either one is totally possible. And then you have to decide, do I want to do it inside or in my car? Interestingly enough, we've had a lot of people who've chosen to do it in their car. And if you have great light and it's quiet, you can do this any place you feel comfortable. Just remember, if you're like lying on your bed and looking over like you would do with your friend or a FaceTime call or something, it might look a little weird. So that's just something to think about. For privacy reasons, I'd recommend that you only use first names of people involved with your situation, that you don't identify your transplant center, and that you don't put anything in the background that might identify your email or phone number. Okay, so now that we have all the practical stuff figured out, you know what you're going to wear, you know what the background is, the light's great, and you've tried it once and you're a little bit over your nervousness. The question is, what do you want to say? And this isn't for me to say, this is for you to think about being a friend or a coach or someone telling the truth to somebody else who would really appreciate it. And what I would really recommend is to think about going back to the time where you were at the beginning or you were in the middle trying to choose what was right for you to do or your family to do. And to then walk someone through that from that point, which is probably from where they're listening from to where you are now, and show them what you've learned from here to here. And be as real as you want to be funny, tell stories, all that stuff that you do just sitting around a dining room table or, with your friend, laughing or crying sometimes, but just like, this is what it's really like. Another thing that's really important to decide before you get going is how many of the prompts you want to talk about. So I want you to know it's not better to do more prompts. The prompts are offered as a starting point for you to jump off into your own story. So different people are like, oh, I love that prompt, or this one's not true for me. Totally fine. Just go through at the beginning when we invite you to choose what you want to talk about and pick some. We found that people who pick less actually do a little bit better, because then they can say, I've picked 8 prompts that are the key parts of my story. And then the videos are about 5 to 10 minutes. The other piece that I didn't understand before I did this right here with you is that sometimes when you're redoing different prompts, it can take longer. So you want to give it some time. So pick a time where you're alert and fresh and this is kind of fun. And you could even have somebody right outside the view that's rooting you on.
Okay, so now that we've seen stories from other storytellers, we've gotten some tips about the best way to go about recording your story. If I can get this link to work, which fingers crossed we can get it to work, I want to do a little demo of what the process actually looks like. So we have the ability to do a test story, and so you'll be part of the audience as we do this test story. Can you still see my screen?
Yes.
Has it shifted from the PowerPoint?
Yes. Now we
Okay.
see your browser.
Perfect. Awesome. So I'm going to tell a test story. So as you can see, at the beginning, it tells you you're about to answer 16 questions on video for Explore Living donation. The arrows at the bottom help you to toggle through each of the storytelling prompts. And so I'll go ahead and press that one on the bottom. Oh, okay. So I know I figured out why it's not going to allow me to do that, because I'm sharing my video for the webinar. It's not going to allow me to do this, but I did want to show you what this would look like. So for instance, once again, there's that first prompt. Hi, I'm LaShara. I received a living kidney donation from my sister about 6 months ago. You can record this, you can embellish or add more to this. You can go on to the next prompt, which I'll do right on the bottom if it'll allow me to do that. It does, awesome. It's not gonna allow me to do the video, but once again, you get to see what the prompt is at the top of the screen. If we weren't sharing the screen or sharing for the webinar, I would see a video of myself as I'm beginning to record. And then I could go back, and as Dr. Waterman mentioned, you can re-record if you're not happy with the way that the video came out. I did a test video, goodness, it's been a couple years ago now. I did a test video from the perspective of an advocate. And it took me way too long because I wanted to say things exactly. I wanted things to come out a specific way, and I wanted to sound a certain way. And it took me a really, really long time to do it. What some people do, and in some of the videos, you can tell that people have scripts, or they kind of jot down their ideas about what they want to share and how they want to share it and how they want it to sound as they share their stories. Other people let things flow organically and just share their stories in an organic fashion. For me, hindsight is 2020. Had I had the opportunity to do this again, or if I have the opportunity to do this again, I would let things flow more organically and not be so concerned about saying specific things at specific time points. The authenticity is what really is more moving, I'd say, in the stories that people share. When you can hear their heart, when you can hear their story, when you can hear their compassion and gratefulness for the experience that they had, either gratefulness for being a donor or gratefulness for having someone donate to them. And so all of this is available through this process. And so I'm going to toggle back to the presentation. One of the things that my colleague, Catherine Pelican, has just done for me, because she's wonderful and fantastic, is she shared in the chat a Google form. At this point, I know we have about 9 minutes left. I wanted to give you all the opportunity to share your story. I've created a Google form where you can share your name, your email address, the story, the type of story that you'd like to share if you'd like to share. And we'll be collecting information from Storytellers. For those who are interested, we will then send you out a license so that you can begin the process of sharing your story through the Explore Living donation website. Any questions for me about any of this? I know I've talked a lot and I've shared a lot, and there's a lot of information to gather from this, but we're hoping that for those who are interested, that we've kind of given you a little glimpse of what this process looks like and how you might be able to share your own story if you're open and willing to.